Well, let me just start by giving you a little bit of history. I'm now 33 years as a nurse practitioner, and when I first started my career, I worked in a supervisory state. What that meant for me was that every one of my charts needed to be signed by a physician. Now, things have evolved over the years where that's not really being done in most states, but at the
Mhm.
end of the day, the physician had to oversee those charts, sign them off. Also, all of my visits were billed out under that physician.
Mm,
And basically, I was an entity that was invisible, right?
mhm,
People had no idea what I was able to generate, what I was doing, because all of it really fell under that physician's title. And
mhm,
so now working in a full practice authority state, which by the way, I'm in New Hampshire, we've had full practice authority for 50 years. And what
mm,
I tell people about full practice authority is it allows me to work to the upper level of my license without a mandated supervisor or collaborator. Now, people think they hear full practice authority, they think, well, you practice in a silo, you never collaborate. And that couldn't be further from the truth. There
mhm,
isn't a provider in America that practices in a silo, whether we have full practice authority or not. What it means is I don't have to work to the paperwork. I don't have to
mm,
have things signed off as long as I'm working within my scope of practice and I don't have mandated collaboration. So it really removes a lot of the barriers, not just for nurse practitioners, but most importantly for patients,
mhm,
because I don't have to find someone to sign things off. Because think about it, if I have a supervisory physician and that physician decides to retire, this clinic would, if I were in a full practice authority state, we have 6,500 patients that see the 11 nurse practitioners in this clinic. Our
wow.
clinic would close tomorrow. So
Mhm,
full practice authority is more giving us the ability to work within our scope and to provide the care that we've been trained to provide without mandated supervision or collaboration.